Welcome to this Kangatech webinar. My name is Hafdom Hagos. I'm the marketing coordinator here at Kangatech. Today, we welcome Michael Davey, who's the Director of Strength and Conditioning and Sports Science at BYU Men's Basketball. In today's webinar, Michael will share his insights on leveraging KT360 for isometric strength training and monitoring in a college basketball setting. If anyone has any questions after this webinar, feel free to leave them in the chat below or reach out to us via social media and we'll do our best to get in touch with you. Once again, we are honored to introduce Michael onto the platform and thank you for joining us.
Thank you, Haftons. Appreciate you taking time, and I hope everybody gets a little something out of it, and what we've been using here at BYU and how it can apply. So in terms of sharing my screen, how do I?
Yeah, so you were just you were on it before, just that slide that you were.
Get back to it. Yeah.
Yep.
So we're gonna look at isometric strength training and how we use it in the collegiate setting. Just a little background about myself. Master's degrees and undergraduate in kinesiology, essentially. So just by trade, I'm a strength and conditioning coach, and so I've been fortunate to be around some really great physical therapists, and that'll kind of delve into where Kangatech fits into what I do. Been 20 years now in the industry, basically working across Australia, the UK, and now the US. And I've been in basketball the last 10 years of my career. And there's some other places. But so essentially I started my career at the Australian Institute of Sport or the Queensland Academy of Sport, and really got a lot of experience with different sports. So team sports and women's soccer, diving athletes, triathletes, swimmers, rowers. So a real diverse background. And it kind of, when I think about isometric, we were using this back in, the mid 2000s, using isometric as a way to monitor and track athlete health and performance. And you see here with swimming, we were using handheld dynamometry back then and looking at, strength values, how strong were they and what were their relative strength, and then looking at their internal, external rotation, et cetera, et cetera. And we started to find some things that were relevant to that sport. So I think isometric training, there's nothing new there. It's been around for some time, but the technology has really made it more accessible and more available. So again, another example, when I was working in rowing, Mark Osborne designed this isometric machine that looks very much, and we call it the Isometer after him. And it's looking at the different positions in the rowing stroke and looking at their force capabilities at each of those positions. And we started to create some normative values and started to use that information to drive our training programs. And, and again, we were using force plates and looking at similar body angles and do they produce a similar force as the Isometer. And we can see that data on the right, the Isometer. Now the data is telling the similar story, so drive 1 to drive 2 phases using the different systems were very similar, although the metrics were different, but the actual story was the same. And so again, using isometrics is something that we were doing 10 or 15 years ago. And then we'd translate that. How do we have that translate to the performance side? So we had a fully instrumented ergometer that Mark Andrews, a legend in sports science in Australia, where we had a strain gauge on the handle, where we got the handle force, position, and velocity. We had the string potentiometer, I don't even know how to say it, potentiometer, where you got the seated position and the velocity. And then we had Kissler force plates, little Kissler force plates in the pedals. So we're getting the forces of the feet, which is what you can see in this graph here, the stroke and the foot forces. And then we were using O2 kinetics. So we starting to put the isometric together with performance outcomes, and then we'd do similar things in the boat. So what are the things that we can do? What can we change performance-wise? So and this is stuff we were doing back in 2010, which was pretty cool. So again, nothing kind of new with the isometrics. Then I moved from the QAS to British Basketball, looking after them for about 5 months before getting called up to the Milwaukee Bucks. And I spent the last 8 years with them. And And when I was in Milwaukee, Suki Hobson, Andrew, and I'll show you who they are. We were using the belt force frame initially and the Nord board in our first 5 years. And then from 2020, we transferred over to Kangatech. And then for a number of reasons, but I just think the software and the structure of the system that were more better, and also the normative data that you get with Kangatech. So this group here and myself were the ones that really drove the isometric introduction into Milwaukee, and how we used it and how we implemented it and what we did to program off it. So on the left here, you had like Luke O'Brien, physical therapist, Suki Hobson, strength and conditioning coach or head strength and conditioning coach, and then Andrew Small, who's a PT from Australia, now the director of rehab at New York. So these minds and just being around this group really expanded the way we use isometric to inform practice, particularly in basketball. And we're going to delve into this more as we get into some case studies relevant for basketball. So some of the innovations we did in Milwaukee, I thought was pretty interesting. Like we saw a lot of people trying to measure, say, seated calf or the ciliate strength, and using Smith machines and bands and different things. And so what we asked Samson Equipment, a company here in the US, would design us a seated calf machine where we could slide in the force plates, or we could take the force plates out and put the feet in, so we could actually use it as a training tool. So this is what the outcome was. There's a little on the right here, you see this little pin. We can pull that and put it into a hole that keeps it isometric so it doesn't move. You've got the force plates behind here, which we can bring to the front, take the pedals out, the feet out, and we can use it as an isometric testing device or a training device for isometric. Say if we want to be at 70% NBC or whatnot. You could use it like that, or you can use it as a isotonic machine, et cetera, et cetera. So simple design, and we've had different leagues, different teams hear about it and wanted to know more about it, like Minnesota Vikings and the Bills and the NFL, other college basketball teams. And so really effective machine for both training and testing. Interesting what I find now that I tend to use the Kangatech now for the seated isometric assessment. Although we have one here at BYU, one of these seated calf machines, I tend not to use it as a testing machine anymore. I tend to keep it all in one house in Kangatech. So now, transition out of Milwaukee about 12 months ago. I've been at BYU for the last year and really trying to implement technology and a scientific approach to how we train and prepare the players. And so to give some context of why I chose Kangatech and brought it to BYU, other than the obviously using it at the Bucks, it's just the changing landscape. So now you have the NIL deals where name, image, and likeness, where players are now getting paid and it's essentially professional. And now you have the transfer portal where players have more ability to move from school to school. So it's really changed the landscape of college basketball specifically. But with that change comes some opportunities. And so to give some context to BYU, this is the coach that brought me in. We had a really good year, our first year, good enough that he's taken the job at Kentucky, which is one of the premier jobs in college basketball. And that opened the door for a new coach, and that's Kevin Young, who was the highest paid assistant coach in the NBA. So now BYU's emerged as a destination for one and done type players. So come to us, we're going to develop you and help you transition into the NBA. So with that being said, now we're attracting different talent, better talent than we've ever had before. And so that recruiting piece becomes really critical. Here's another young man that we're looking at recruiting, #1 draft pick for 2026. Really talented player, set to visit. So what's our pitch? How are we selling our program to him? And so that's where, for me, Kangatech sits into, using it as a recruiting tool. and that link with the NBA, Kangatech, is really important to us. And so, 14 out of 30 teams in the NBA using Kangatech, and so we have a huge normative, or Kangatech have a huge normative data set, and so we can really use that and leverage that. Kangatech's also been doing some testing in the NBA draft for the last 2 seasons. I know they don't like to talk about it too much, but I just know it's there. And so, it's again part of our pitch to the players. So when we do a profile, and I get a recruit, I'll be saying, I can compare you to NBA athletes. So we can get this assessment of your hip or whatever it is, and we can compare you to your colleague that you're about to join. I always say, we can use this data to individualize your training. And also, we can get you a year ahead. So you're going to see this technology when you go to the combine, when you go to a team, potentially, you're going to see this technology and you're going to get that experience with it. We're going to help address some of these limitations you may have. And so we kind of get you ahead of the game a little bit ahead of your competitors, so to speak. So that's kind of our pitch. Part of our pitch, and Kangatech kind of sits and ticks a lot of boxes in that regard, where we're trying to attract, the one and done type players. And I think it does. It really resonates with them when they see it. Their eyes light up. They're really interested. They're engaged with the numbers that Kangatech are giving us. So in terms of implementing Kangatech in the collegiate setting, I think it's different to the NBA. And so I'll just talk briefly about those differences I see. Firstly, in the NBA, you just got more resources. So you got physical therapists, you got athletic trainers, you got strength and conditioning coaches. Well, generally in collegiate setting, you might have 1.5 athletic trainers, you got 1 strength coach. And so, the physical therapists are generally more responsible for the Kangatech testing. And that's the way it was in Milwaukee. And the PTs have a really strong foundational and technical knowledge about isometrics and how to treat tendinopathies and et cetera, et cetera. And so the Kangatech would generally live in the medical area in the NBA, and the medical team would generally, doing the testing, the diagnostics, and then the strength and conditioning coach and the PT are working together. But the PT is really leading that space, and then the strength and conditioning coach is assisting them in that. And I really like that language, where PTs are leading and I'm assisting, and at different times I'm leading and they're assisting. So coming into the collegiate setting, Kangatech, I brought Kangatech to the athletic trainers, and it was they didn't really have much exposure to isometric testing, and so there was this period of education, showing them the value of it, what it can do, where it sits into injury rehab or profiling of athletes. So that's a different prospect to what I was facing in the NBA. So at the moment, the Kangatech machine lives in our weight room, and I'm the key driver of it in terms of deliverables and how we use it. And so I'm really leading it, and the athletic trainers assisting. So it's a different dynamic, and it could be different in different situations, but that's the way we have it right now at BYU. And so it requires me to educate and to do other things that are different to what I had to do in the NBA. So this is just where it lives. Has a home in here. We use it for assessments, and we'll go through some of the details of it as we go. So in terms of deciding what assessments on the, what isometric test do we want to do, we really need to go back to the injury profile. And, there's a study looking at 16 years of college basketball, and you see that, and we're going to go through this in more detail, but there's one predominant being the ankle sprains, and then there's just very small percentages of a lot of different injuries, which is a lot different to a lot of other sports. And we'll go into a little more detail, but we average about 10 injuries per 1,000 hours of exposure, and that's been pretty consistent over that 16-year of tracking. If you look at NBA data, it's about 20 injuries per 1,000 hours, so twice as many. In the NFL, there's 34 injuries per 1,000 hours, and then in the AFL in Australia, there's about 25 injuries per 1,000 hours. So we relatively don't get as injured as often as some of the other sports, in which I'm seeing that, being in it now for 12 months. Out of all those injuries, 60% of those basketball injuries are lower extremity. That's the predominant nature of our injuries, which makes sense. And like I said, 26% of those are ankle sprains. In terms of the second most injuries, it's a lot of the knee internal derangement type injuries, and they seem to have the longest impact or the longest time out. And so they cover up to 70% of the injuries that we get. So what are we doing? How are we protecting the knee joint? How are we going to address that injury status? And so there's been some great research with Damien Harper looking at deceleration. You see the amount of stress that deceleration puts on the hip extensors and the knee extensors when decelerating. So, and then you put that together with the catapult data that we collect from college basketball. You see decelerations are on the right here, and you got accelerations on the left. The decelerations are twice. You can always say that almost twice as many decelerations as there are accelerations in basketball, and it's pretty consistent. You can see different practices, it stays pretty relatively the same. And so you take that increased deceleration workload together with the greater stress on the knee extensors and hip extensors, finding ways to assess, the knee extensors and hip extensors becomes really critical. So understanding the context of the game, how much jumps do we do, how much change of direction do we acquire? And you can see the change of direction, the twice as many of the accelerations and decelerations. And then you're averaging, about 80 to 100 jumps a practice. So just understanding the dynamics of the game and what that might mean for different stress areas. So we come back to the knee, it really does cause a lot of stress on the knee joint. In terms of overuse injuries, so this is things like tendinopathies. I do wonder if these are underreported. So 0.5% injury rate per 1,000 hours. I do think they're underreported, and I do see a lot of tendinopathies. I just don't know how well they've been documented, hence the low number. But I think obviously need to be addressed, particularly the patella tendinopathies in basketball, which makes sense. And they make up about 2% of the injuries. So in taking all that profile, where does Kangatech fit in all of that? Well, we can use when you get ankle sprain, we can look at seated plantar flexion. You can look at calf capacity. When it comes to knee internal derangement injuries, we can use the hip profile together with the thigh profile and the calf profile. When you're looking at, and you just go down the list. So knee extensions for quad contusions, knee extension tests for patella tendon, hip strain, so that hip profile becomes really important. So we can start to align the test and why we're capturing those together with the actual profiles that we're, the injury profiles that we're seeing in the sport. So that kind of justifies why we've selected some of these tests, and we're going to go in more detail about those. So you see, unlike a lot of the other field sports, we don't get the same amount of soft tissue injuries like hamstring strains, groin strains. We get a very small percentage of those injuries coming from those areas, although we do get them, just not at the same rate or frequency as some of these other field sports. So our profile is a little different in basketball. So just to quickly just go through my current philosophies, and there's been lots of people that have influenced me and taught me different aspects and where isometric training can fit into the overall program. So keep in context that the physical is only one component of the whole athlete. So we're just going to focus in on the physical, but knowing that this is only one small part of the big picture. So when I think about athletic development in its simplicity, I think about body. You need to have the right body composition. You need to be able to move well, so movement competency. You need to have the right range of the motions at different joints, and then we need to have a good energy system. And that's a really important part to having a strong foundation. So the wider that development base, the more capacities we have to build on top of that. And so strength and the different categories of strength builds on top of that foundation, and then we can apply that to power and game speed and things of that nature. So when I profile athletes, I use a product called Goalscape. So you have the physical profile, and then you can see the main characteristics that I look at: body composition, flexibility, conditioning, movement competency, strength, power, and multi-directional speed. But within each of those, there's layers of different assessments. So if I look at strength, for example, you have heavy dynamic strength. So if I looked at the upper body, you have your classic, bench press 1RM, bench pull 1RMs, pull up 1RM, etc. Same with the lower body. You got your 1RM squats and hip thrusts and different things like that. You got explosive strength in jump squats and trap bar deadlifts and Olympic lifts that we're assessing and monitoring. And then you got these isometric space. So, all your classic isometric mid-thigh pull. Now you've got the belt squats and things of that nature. And then Kangatech fits under that umbrella. And so it's giving me a set of data in one aspect of the total athlete. And so just understanding and keeping isometric training into context of the whole athlete and the sport that you're assessing. So we've got hip profile, thigh profile, and an ankle profile. And we kind of lay down deeper into each of those assessments, and we'll cover that. So some of the reasons I use isometrics is to control the controllable, so management of soft tissue injuries, obviously. Strong muscle capacity and symmetry equals reduced likelihood of injury. So an accurate way to assess that. From a practical standpoint, isometric training is less stressful than other MAC tests, like a 1RM squat, pretty taxing. So we can assess this way more frequently and more safely, particularly in season. And we have a large data pool now. We can compare ourselves to NBA athletes or within the BYU squad itself. So we've got a lot of normative data to benchmark. So that becomes really valuable. And so we can create some baselines that we get injured. We know where we need to return them if they have a soft tissue injury, things of that nature. And then we can prescribe some maximal loads really accurately with these isometric tools like the Kangatech, and that becomes super valuable as we try to progress through the rehab. Maybe say like the validity of the isometric assessments is becoming stronger and stronger as the data is coming out. So it's becoming a real valuable, valid, and reliable measure of muscle strength. So that makes it super important. In terms of the testing protocols at BYU, so this is the protocol or the process that I go through when we get new athletes. I'll sit them down for 30 minutes in my office, and we'll talk about, get to know them. So this new athlete just joined the program. What's your training history? What's your injury history? And then we take all that information in the background to understand what we may need to assess a little more. And then ask them, what are your goals? What do you feel like you need to work on, et cetera, et cetera. Then I'll do a flexibility assessment. Do they have normal range of motion across different joints? We'll do a movement competency screening. So can they squat, lunge, push up, pull up? Do they have basic trunk endurance? A lot of the McGill trunk endurance testing, etc. And then we jump on the force plate, and we'll do a full battery of force plate testing, and then we'll finally get him on the Kangatech and do a full profile. So in all, it takes about 2.5 hours to get through this full assessment, but at least it gives me a starting point of where to start with this athlete, what are they bringing to the table, and what are the gaps, and then we can map out what to do next. One thing I love about the Kangatech, as soon as I finish the assessment, I can bring him straight to the app on the pad, or I can take him to my computer, and we can talk about the data right then and there. And that really resonates with them when we go to putting in interventions or training programs. So that's one of the things I love about Kangatech. It's just automatically report the information and makes it usable. So that's super important. So I'll generally test at the preseason. If we have any rehab programs, I'll use it obviously, and then mid-season. So around the end of December, so between our conference and non-conference games, we'll get another baseline assessment, and then at the end of the season, we'll retest. And so we're trying at least 3 times a year. We're capturing the profiles, and then if we have injuries, we're obviously capturing that specific site, whether say a hamstring or quad, as part of that rehab plan. One of the other things we're looking at, we have a PhD immersed in our program, and we're looking to assess lower body strength, muscle power, muscle volume, and tendon health across a season. So we're getting MRI of the lower body, and we're getting each muscle groups being measured. We're using ultrasound on the tendons of the lower body, looking at how they change over the season. The DEXA scan, looking at the lean mass changes. The DEXA scan kind of telling what the MRI is telling us. And then we use the Kangatech as a mediator too, so knee extension and the plantar flexion. And then we're using jumps, and the training loaded data. So we're putting that all together, trying to see how things change and evolve over a season. So we're measuring preseason, mid-season, and at the end of the season. So I think it's going to be super interesting research, trying to tie together strength, power, the training load with some changes in muscle tissue. So again, and just another practical reason to use Kangatech, because it just gives you really valid and reliable information. So in terms of the assessments that we use at BYU, I do a hip profile, thigh, and a calf. And so with the hip, we do hip abduction at 30. We do the hip abduction at 30. We do hip flexion at 60. And then we do the hip extension. So that's our hip profile. And then we move into knee flexion. So we look at hamstring. And then we do knee extension. And then we do ankle plantar flexion. And then one of the things I've noticed with the taller basketball athletes, they're actually a little bit too tall for the device. And so I know Kangatech are about to bring out an extra large version that's longer. That's going to make a big difference in terms of doing the plantar flexion test. So we do have sometimes it can get a little jammed in there trying to get that test done. So if you've got tall athletes, maybe you might want to consider the taller units that have just come out. And then we finish on calf capacity. So Kangatech had the metronome and the counter app inside the app, and the tempo is generally a 60 beats, but you can adjust it. But I normally go 60 beats per minute, so 1 second down, 1 second up. I've also used the app together. It normally works pretty well, just to make sure we're getting consistency with height of each calf raise, and we're getting quality data from each one. And so there's been some research just around that, standardizing how you start, whether you're on the floor, off the edge, or off an angled box. And they've shown that actually different tests, they have different demands. So just being consistent with whatever method you use. For me, I use off the edge of a power block or off a block or step. Shoes are off, and we're not holding onto a bar. We're just balancing underneath, and we're keeping with the metronome. So just being consistent makes a big difference with the protocol, but just something I thought I'd put in there. So that's basically the basic baseline assessment that we do, and it gives us a lot of information. So in terms of taking that, what's the performance standards in elite basketball? So Andrew Small, who was a PT at the Bucks and now is at the New York Knicks, would work pretty closely together, and these are his standards. So if you look at the different minimum standard, it's 2.25 Newton meters per kilo. So Newton meters per kilo takes into account their lever length. So we actually measure the length of the lever. So from greater trochanter to the midpoint of the end of the femur, etc., and we get all the different lever lengths and then their body mass. So now we can really compare apples with apples. So irrespective of the lever length or the body mass, we can really make it relative to everybody. So 2.25 is the minimum, with an ideal standard being 3, especially for the hip and knee test. And then hamstrings about 1.5 to 2. So you can look at these numbers; they're actually pretty like the minimums, and particularly the hamstrings and calves, maybe a lot less than what others are reporting. But I think that's the nature of the basketball athletes that we have. We got very long athletes, maybe not as a stronger history of training as maybe say AFL or some of the other sports. So we're not seeing as high numbers perhaps in comparative to the AFL or other sports. And then in calf capacity, a minimum of 20 to 25 is ideal. And then we start to look at ratios. So in terms of hip adduction to hip abduction, we want to be a little bit stronger on a hip adduction, about 10%. So we want to be a little bit stronger on the hip adduction. And then with the hip extension, we want to be obviously stronger than hip flexion. Now, James Moore gave a great presentation by Kangatech. You should encourage you to watch it. And he discussed a lot of the intralimb profiling. So looking at quad to calf, hip extension to quad, hip extension to hip adductions, and different things like that. And he kind of gave some different ideal ratios. I do think this is an area that needs more research and more work. And I think it's super interesting to look at that in more detail. And on the next slide, we're going to talk about the hip extension, the quad ratio, something that Chris Powell out of California been looking at, and something that we're kind of looking at the Bucks as well. So yeah, I just think there's more research to be done in that space, but I think it's really interesting. So kind of taking that ratio concept, we identify that knee internal derangement is the big issue. So how do we offset or unload the knee joint to make sure that it can handle the high number of decelerations and change of direction and jump and lands? And so if you have a very hip dominant strategy, you're probably going to have a much more your hip extension quad ratio is going to be much more balanced. So you've got a lot of hip strength that can offset the quad together with the quad strength, and you're going to offset a lot of that knee stress. So that's one of the areas that I know there's some early research in, and I think needs more investigation. Or is it going to be a coordination issue? Is it the biomechanical analysis of the jump and land, or the change in directional decels? Is that the issue? They actually have capacities, but they can't coordinate it together to make it a smooth deceleration or change of direction. Same goes with the knee dominant strategy. Is it a capacity? Is the quad strength greater than the hip extension? So we got real strong quads, but the glute and hips aren't doing their part, so to speak. So much more knee dominant strategy. And that increasing that load on the knee joint combined with the coordination again. So starting to look at these ratios, I think might start to tell some stories of how we can, decrease some of these joint stresses, et cetera, et cetera. And I think this is a really interesting area of research, and something that we're going to start to look into maybe a little bit more. In terms of normative data at BYU, so we have a pretty obviously young program, average age of 21, our mean body mass and our heights. You see the bigs are starting to get a little shorter and shorter. They're not as tall as they used to be. So the game has evolved and changed and adapting. Keep a note that the normative data that I'm showing you is 23 athletes in total, so not a lot. And it's only over 2 preseason testing. So it's pretty small data set, but pretty a good example of what the data is. So in terms of the hip profile, hip adduction, the average of the squad was 2.08. So remembering that 2.25 to 3 is kind of ideal. So red being we need to work on that area. Hip abduction with 2.41. So we have pretty good hip abduction. So that's pretty good, but still has capacity to get better. And then hip flexion with 2.02, again underperforming as a group. And then hip extension was significantly under as a group at 1.82. which leads to our intralimb asymmetries are below what we'd ideally like at 0.86 for the hip adduction, abduction, and then the hip extension to flexion 0.9. So you can see overall of the hip profile as a collective group, we need to improve and get better. But again, I mean, fairly young training age with these collegiate athletes. They've still got a lot of room to grow and improve athletically. In terms of thigh and calf, the knee extensions are pretty good. So we're 2.64 as the average group. And then our hamstrings are pretty weak, 1.48. So ideally, we want to be 1.5 to 2. So we got some room to work there. And then this is our intralimb asymmetry. I still think there's more research and numbers needed to understand what's actually good there in terms of the knee extension and flexion ratio. The ankle plantar flexion is 1.92, so pretty good, with our standard of being 1.5 to 2. So we're pretty good on the calf strength, and then calf capacity is excellent across the group. Pretty much everybody's hitting the standard in that regard. So here's examples of showing the group data as a whole per test. So we have the hip adduction test. So in terms of looking at our standard on the right here, 0 of the players were over 3 Newton meters per kilo. We had 5 of the in the average range, so within the normal range of 2.5 to 3, and then we had 10 under. So hip adduction, the big issue for us, we need to address it. And then hip abduction, 1 out of the 15 actually meeting the standard, 11 out of 15 are kind of in the average range. So and then 3 are poor. So much better in this space. So that should reflect in my program and what we're doing to intervene and try to get the hip adduction numbers up. In terms of hip flexion, we have 0 out of the 15 meeting the standard or above the standard. We've got 5 out of 15 that are average, and then we have 10 that are below. So the hip flexion is, again, another area that we need to address and get better at. Hip extension, we had 0 out of 15 players that are over 3, 7 out of 15 that are in the average range, and then we have 8 that are poor. So again, another area that we need to address. And then the knee extension, we had 5 players over 3. 9 that are in the average and 1 that's poor. So we've got pretty strong quads. And what was interesting with some of the asymmetries, you got FT, this player here, Foos, he's on his left side 3.06, on his right he's 2.5. Last year he had a meniscus repair, or this offseason he had a meniscus repair. And so we're still trying, he's still working to develop that quad strength on that right leg. Left patella issues historically on his left patella for Caber. So you can see here 3.05 on his right, but 2.25 on his left. So again, with some work that he needs to do there. Mawat Mag, transfer athlete, did his ACL at his previous school 12 months ago. And you can see, if I can find him, here, he's 2.86 on his left and 2.4. So these are pretty significant asymmetries on the knee extension. And so what I like about this is the injuries are matching what you may expect out of a knee extension test. So it's meaning the test is picking up stuff that it should be picking up, or what you hope it should pick up, which makes it useful information in terms of, hey, we need to continue to work on quad strength or whatever it might be. So hamstrings, obviously, 0, that's over the standard. We get 11, and that's kind of in that average standard, and we got 4 below. So still some areas to work on there. So again, we're using the data to really inform what I need to do next and where I need to focus some energy to improve and lift the overall profiles. Calves were pretty good, 7 out of 15 over 2, 7 out of 15 above average, in the average zone, 1 below poor. I've seen James Moore talked about some in the 3 to 4 Newton meters per kilo per body weight. I haven't seen that in the NBA or the collegiate level, so I'm not seeing a lot of that really strong calves. Not as strong as maybe some of the other sports that we're seeing. So once we've got this profile, Kangatech will put together the hip profile, and what I like, you can compare to the NBA public data. And our first goal is to get strong. So if these athletes can get to 50th percentile versus an NBA athlete, meaning you're the same as the average NBA athlete, that's your initial goal, and that's a good target. So you can see with this particular player, he's pretty good at hip flexion and adduction. Hip extension can improve a little bit, and his hip abduction can improve a little bit, but he's got a pretty good profile, and that's kind of my first target. Can we get you to the 50th percentile across the board? Once we have good enough strength, then we can look at the asymmetries. And so Kangatech presents this information pretty nicely. You can see pretty quickly where the asymmetry. So in his adductor, he had the asymmetry here. And so, then we can address the asymmetries as a second priority. But I think normally, you're going to prioritize strength first. Can we get them stronger as the protective element? So as you can see here, we got different hip profiles and different variations. So you got different weaknesses and strengths in each of these athletes, and you've got your normative values in the 50th percentile, with 100th percentile being the strongest NBA athlete ever, and the 50th being the average. So you can see everyone bring different things to the table, which means we're going to address different strengths and weaknesses. So the way I address it outside of just the normal strength program where we're developing, holistic strength and et cetera, squats and deadlifts and all those normal things, what's been called the CARE program. And I got that acronym from Ashley Jones, who's a well-known strength coach from New Zealand and Australia and in the rugby circles. And it basically stands for core, accessory, and rehab exercises. So some people call it rehab, prehab, whatever you want to call it. We call it care. Good coach will say often in our practice, like, hey, take care of your bodies. Well, that language suits sharing this. And so we use Bridge Athletic to develop these individual workouts to address, say, some of these weak areas that we're seeing. So whether it's a quad issue, an ankle stability issue, whatever it might be, we'll create these playlists in Bridge where they can come in and do these workouts on their own or with me to address these weaker areas. So these are just examples of how we kind of deliver once we've got the assessment, how we're going to deliver outside of the normal training. So I really like that acronym. I think it fits well with team sports. Go do your care program. Now let's get to the fun bit, the case studies and how we put Kangatech into action. One of the things I'm dealing with was this ACL of a transfer athlete that just arrived here a couple of months ago. And so we used the Kangatech test. And so here you can see his initial profile, his right knee, his left leg. Like, we got some pretty significant asymmetries, which you can see over time. So we've got 3 different tests, and he's actually dropping in some of these assessments and some of these asymmetries. But the key point I make here is that, like, the Kangatech giving these objective data, like, hey, like, talking to the athletic trainer, like, we still got a quad deficit here. We really need to end with the athlete. We really need to address this, and it also tells us if our programs are being effective. So we put in the intervention, and we found that we weren't really making that much progress. The left knee was dropping in strength, but the right knee made a small improvement, and then made a better improvement, but not the kind of improvement that we really wanted. And so we had to go back and reevaluate the program that we gave him. Was it actually working? So you can see that baseline there. He's 40% asymmetrical, which is very significant. And then at the end, we're down to 23. So we've made some improvements. So it shouldn't be so critical, but we're still not exactly where we need. We still need to continue to work. And that just drives the conversations that we're having with the athlete, the coach, and everybody around this athlete to make informed decisions. So this is an example of the care program that this athlete was on. We're using leg extensions, we're using leg presses, we're using different kinds of single leg exercise, BFR, and ultimately we made some improvements, but not as much as we ideally would like to make. So we're going to continue to adapt and evolve this program based on the feedback we're getting from Kangatech. You can also see, like, using DEXA scan, again, looking at this particular athlete, he's got that asymmetry on his left. He's got more lean tissue or asymmetry on the left side of about 2 pounds. So again, we're building muscle. We're starting to tie together all this information. So he's got a deficit in force capability in the isometric. How did that express itself in power exercises? So using Hawking dynamics, you look at his counter movement, he's actually pretty symmetrical. So he can actually produce force fairly evenly in his vertical jumping. And then we looked at his squat jumps, telling a very similar story. He doesn't have an asymmetry in the bilateral jumps. And then even in the drop jumps, the dropping off a box, double-legged, he's producing, there's maybe a small difference here in the peak forces, but he's producing, I would say, quite evenly power in the bilateral. And the same goes for the multi-rebound jumps. Some slight differences, but nothing significant. So bilaterally, he can produce force and he can handle that really well. It's not till we start to go into the single leg jumps, and Edna King done some great research, his group, around ACL and using the a drop jump off single leg, and they're showing that to be a real indication of knee stress and the ability to handle knee load, which is obviously relevant in the ACL. And you see different metrics, like jump height, contact time, RSI, the braking RFD. So you say this is the metric that's been coming up in Edna's research, and you can see there's some asymmetry there. And so it wasn't until he moved to the single leg where he really starting to show those asymmetries versus the bilateral. And the same goes with the multi-rebound jumps. You can see his left leg in the blue, right leg on the right, and the jump height, RSI and the RSI itself. You can see he's just not producing the same amount of output versus his healthy leg. And more specifically in the counter movement jump, really shows some asymmetries in some of these metrics. And so that really drives now our program should have a huge emphasis on unilateral work versus the bilateral jumping and explosive work. And so we, again, tying together all the data and how this athlete's handling that training. We use view motion. So again, can he express this force horizontally? And going back to that, you can see like there's very little difference between left and right. He actually can produce force left and right in terms of his stride length, contact times, etc. He can actually express it in acceleration. And this kind of reflecting, we won't go all over the numbers, but to say that, this information tells us more than just the peak force capacity at a set joint angle in one moment, but how can he express this over, this force capabilities in different tasks that he's going to get exposed to in the game. And so, he can accelerate pretty well. What we don't know, we haven't even had a chance to get to the deceleration using view motion, both a linear deceleration test or a 505, and it's something that we're about to implement into the program. So I don't have any data to share with you, but I'm super interested to see his ability to decelerate and what's the strategy. And kind of go back to what we talked about, the internal knee derangement injuries. What's his coordination? They're looking at the kilograms of his movement, his strategy, but then tying that together with his capacities. So so that's something that we're about to endeavor and look at in more detail. So, and then wrapping that up, just trying to take the Kangatech together with the other information and help inform where we need to target our interventions or our training to help this athlete kind of make the next step and make some progress. Another injury we currently have a groin strain. I've only seen a handful of these my whole time of 10 years in basketball. You don't see them too often. Freshman athlete, and I'm going to show how the Kangatech can be used as a training tool at sub-maximal loads. So, we got a hip profile of this freshman athlete. You can tell he's pretty weak. pretty low scores. He's in that 25th percentile. And obviously our goal is to get him into that 50. He's obviously got this odd number with his hip extension on the left. Maybe that's a poor test, I don't know. But overall, he's pretty weak in terms of the hip profile. And you can see he's had this grade 1 adductor strain. He did it in a sprinting up and back on that 180 turn. He felt it and had a groin strain. And so, the training load wasn't an issue because we only had 4 hours of training on court, 4 hours in the weight room. So that wasn't a major issue. Was it the fact that he's just weak globally? So what we have here, the baseline, he's about 45 kilos on the hip adduction test. So once he got injured, I said, I want you to go as hard as you can. He was about 10 days post-injury. I want you to go as hard as you can without pain. And what he showed, he could produce about 33 kilos of force without pain. Now that we've had the intervention and we've rehab, he's actually above his baseline, both left and right. So he's come out the other side stronger, but a little bit of asymmetry there. But going back to this injury data, we've got 33 kilos that he can actually produce. And so let's train him using that precise measurement to train him at submaximal loads relative to that 33 kilos. So we can spend some time isometrically training that tissue, overloading that tissue within the capacity that he has through that injury. And so we can, within Kangatech, you can build out programs. We started with an acute pain modulation because he still had some awareness. So it was 20% of maximal capacity at that 33 kilos, 6-10 seconds, 10-second rest. And then we followed it up with 4 20 seconds, more of a strength endurance at 50% of MVC of the new max, which was 33 kilos. And so, again, it's just a great training tool, great way to use it as they're in that early phase of that rehab to get that tissue adapted as soon as possible. Not wait until he's got no pain, no awareness, and then we're going to load that tissue. So Kangatech has a really sensitive measure of tracking the exact amount of intensity and then profiling how he's adapting to it. So that's another example. A really cool example is the herniated disc, and this is just a novel thing that we stumbled on. But we had 2 athletes. I've had 2 of these in my 10 years in basketball. One was an NBA athlete, one's a college athlete. Both are 7 foot, 280 pounds. He had a previous herniated disc early in his career, and we tried to manage it conservatively for 8 to 12 weeks, but before decided to get surgery. The college athlete, 7 foot, not as big, 220 pounds, no history of lower back. And we try to manage it conservatively 8 to 12 months. So let's look at this relationship between calf isometric strength and herniated disc. And it's the nerve running down, it's feeding into that calf or leg. It has different nerve roots. And so when we get different weaknesses, we can almost identify where it's stemming from. And so it really started with this NBA complaint of just feeling weak in that calf and had no lift or pop in that side. And so that made us kind of test to see the calf to see what his capacities were. And what we found that he had a 30% drop in calf capacity from his preseason baseline. And this athlete was strong. He had a 3 Newton meters per kilo. So really strong, and that was a pretty significant difference. And when we saw that, after the conservative nature of what we try to do, we decided that surgery was the best option. So to look at the Kangatech of the collegiate athlete that I've just had, we use this information as key criteria to feedback to the surgeon that operation was probably the best path forward. So you can see with this athlete, he started off pre-injury 1.81 on his left, 2.17. So he had a 13% asymmetry at the baseline. Once he got injured, he had a 50% asymmetry. So he lost a lot of capacity. We did try to conservatively do it for 8 to 12 weeks, and he got better. He got down to about 35% asymmetrical, but wasn't enough to make us happy with his progress. And so we decided to go for surgery, and then we did the CETA test 4 weeks post-surgery, and he was down to 17%. And now we're about 8 weeks, or he beyond that now, but 8 weeks, and he was 11%, better than his baseline. So the use of Kangatech as some feedback criteria for the surgeon, nerve capacity or strength is a key indicator of whether they should do surgery or not. So that information in both instances played a vital role in making the decision after 8 to 12 weeks of trying to do it conservative that we needed to get the surgery. And in both cases, they had a similar outcome. They actually got significantly better pretty quick. It got to within normal calf strength ranges. What I like about the calf test, you can test it pretty early. Even if you had back surgery, you're in a seated position, so their back is safe, and you can get a maximal calf output that's telling them the health of that nerve pathway. So just something novel that we stumbled along with Andrew and Suki and myself, working with different athletes. So maybe something that's super interesting to others. Okay, like moving on to patella tendon management. A lot of you have heard Jill Cook's work, and others, it's becoming more common knowledge, which is great. The stressing the tissue with strength and managing the elastic energy work and modifying that if we progress between a reactive tendon or tendon disc repair, et cetera, et cetera. So a lot of this stuff is not new to many of you, but how we kind of use this information and use Kangatech to manage the acute on chronic tendinopathy, which are super common in basketball, obviously. And the first bit I'd say is like the load capacity and load tolerance is the most important thing to manage. Like people get injection, PRP, take this supplement, do this taping, ice it. Like those are only 1%ers, I call them. They're only a little bit of the piece. If we don't manage improve load capacity and load tolerance, we're not going to really make headway in managing the tendinopathies. So one of the ways that Andrew Small and Suki had a particular athlete in the NBA, this is how they kind of devised the management of it. So let's say this athlete presents with a hot tendon, so it's acute on chronic. We'll get him on the Kangatech and do a leg extension test. So it'll be 2 to 3 5-second max efforts, and you're going to look at their max capacity and where did that relative to their normal capacity. Is it down? Is it the same? And we're also going to take their pain score. So if their pain score is over 4, okay, now we need to make some decision that how we're going to manage it, particularly if it comes together with a drop in strength capacity. So in terms of once we have that baseline in the morning, we're going to put an intervention in to try to manage the pain. So the leg extension isometric are well documented to provide pain relief. And so 4 sets of 45 at 70 to 80% MVC. And one of the things we found interesting with the Owens or the BFR protocols, the 30, 15, 15 at 80% of occlusion, really helps a lot of players reduce their pain levels and their ability to move without pain. So these two together are a pretty potent combination in terms of pain management. Now, what I see happens a lot, and what we see happen a lot, people think that that's the workout, and that's not the workout. That is to manage pain. So now you can work out and expose the muscle and the quad to high force capabilities or capacities. So we're doing leg press or step ups or whatever the strength exercises are. We're actually exposing that tissue to high force capabilities. So once we've gone through that process, we then go through Kangatech. Sorry, that's my AD. Through Kangatech, and we retest that. So now have we got to increase output in the strength capacities? Is there a reduction in pain? And then now we can start to decide how we're going to manage the on-court. Because the on-court is what's really going to stir up the tendon. So we really need to decide is he available for practice, is he modified, or is he out? And so we can use this information to make those decisions, to help us make those decisions. And there's a lot of other factors, obviously, that go into that decision. But now you've got some real data to help support what's the best step for that athlete. Should we modify him so he's available for the next day, et cetera, et cetera. So 4 out of 10 pain was a threshold for us. If you're over that, we're going to modify some way. If you didn't get an improvement out of that protocol, when you probably got a very hot tendon, so to speak, or very acute tendon that may need just some loading, but without the on-court jumping, landing, changing direction loading. And what we found, just doing that protocol, people were getting 10 to 20% increase in strength and a significant reduction in pain score. But I would say there are some responders and there's non-responders to it. But I think you could play with that framework and really use it as a guide to when people can get on court and when you might want to modify training. So I think it's something that Andrew and Suki developed. I think it's super cool, very insightful, and a good process. So in saying all that, once you have that information, you really got to be able to manage your on-court loads. So understanding what's normal loads and variances and different movements, are they outside of normative for that practice or that game? Really managing the on-court's super critical. So using technology like Catapult, which is what we had, managing the number of changing direction jumps and all that play a part in managing that tendon as well. So that can't be overlooked. So that's kind of like some different examples of how we're using Kangatech, how it helps kind of inform and instruct what we need to do and how we need to do it. I hope that there's something in there of value to you. I hope I didn't just ramble on for nothing, but if there's any questions, you can hit me up on these, Twitter or LinkedIn or email. Always happy to chat. So again, but we're always trying to adapt, evolve, learn. What can we do better, et cetera, et cetera. But I think Kangatech for me just a valuable tool in the way we operate and do things at the moment here at BYU.
Yeah, awesome. Thank you, Michael, for your time. We really appreciate you having you on. It was a really insightful webinar. Once again, if anyone has any questions, feel free to reach out to us or him, and we'll do our best to get back to you. Thank you once again, Michael.
You're welcome.
Easy. Ciao.